factors. So on the left-hand side, the risk factors mainly unique to women, right? So we talked about hypertension during pregnancy. So it confers threefold higher risk of ischemic heart disease, meaning blockages related heart disease. Early menopause confers at least 4.5 times higher risk. Same thing with gestational diabetes. And we talked about the lupus and the rheumatoid arthritis. Then psychiatric factors such as depression, anxiety, right, post-traumatic stress disorder. So women are relatively more prone for this. These need to be identified. They need to be screened for this. They need to be treated for this. Very, very important. And there is another condition called broken heart syndrome, we call it. It's called stress-induced cardiomyopathy. And in my practice, I can tell you, like, I'm seeing more and more of this. One is definitely because of awareness and the advanced imaging that we have, but also that with the increase in the prevalence of depression and stress, we are seeing more and more where, for example, a woman had a recent emotional issue at home, right? Then like they present with sudden onset symptoms of shortness of breath or not feeling well or some chest tightness. Sometimes we also see blood tests that almost look like heart attack. But when we take them for coronary angiogram, the arteries look fine, especially the top or the arteries, the big arteries, they look fine. But the heart pumping, especially the tip of the heart, doesn't move. We call it apical ballooning syndrome as well, because the base of the heart tries to compensate for it, and the tip of the heart is not moving, or it just balloons out. Luckily, it is a reversible condition in a good percentage of women once they are treated with certain medication. But it's important to be aware of the risk factors so that they can be addressed beforehand, and it will not lead to the heart disease. Now, moving on. So for this set of risk factors that we talked about, which are unique to women, the important thing is, in addition to treating them during pregnancy, they need to go back to their physician, and they need to be reevaluated within 3 months post-delivery to see where they are, what are the other risk factors they have, or what can be done, right? And then from then onwards, timely screening and education are very, very important, because it cannot be taken as, oh, that was pregnancy-related diabetes, now the sugars are better, everything is okay. It's good if the numbers continue to look good after, but they need to be screened, and there need to be a discussion between the physician and the person about the risk, and to be aggressive about the lifestyle modifications. Now, moving on to the traditional risk factors, these we usually commonly hear about, right? About the diabetes, about high blood pressures, high cholesterol, sedentary lifestyle, smoking. So this is a big list of all the risk factors. And some of them I put in blue because all of these risk factors are important. Each and every one of them have to be addressed, and they need to be treated. But there are certain risk factors which have shown to be even like they confer very high risk for a person to develop a future heart disease. So in the past, smoking is still a major risk factor, but it was the leading cause of preventable heart-related deaths. But now the suboptimal dietary habits have taken the first place. So smoking is still in the second place in terms of preventable causes of mortality, or meaning death or morbidities. So suboptimal dietary habits, sedentary behavior. I cannot emphasize on these two enough, because these two are the key for majority of rest of the things. Yes, there is genetic component. There is, it does play a role to some extent, but majority of it is because of these two. And then the other things that we were talking about, such as stress and depression, or other habits such as smoking, alcohol, drugs, family history, and sleep apnea is another risk factor, emerging risk factor that we have realized that it is also underdiagnosed and undertreated, which can increase the risk of future heart-related events. So this is again just to summarize what I have been saying about the risk factors, because I wanted to show you that how, so we have several risk factors, right? Like if we look at them separately, high cholesterol, high sugars, high blood pressures, but many of them are interlinked. One thing can make the other thing worse or put the person at risk for having other risk factors. And among all those, again, like it comes down to the physical activity, inactivity, where can contribute to the development of majority of these risk factors. And one risk factor can have, I would say, adverse effect on the broad range of these risk factors. Okay, here, so I'll show a few slides just to give you the evidence, because it's not only like my word, I want it to be as an evidence too, right? So physical activity and effect on mortality, right? If we look at like worldwide, actually it's the fourth leading cause of mortality in people, physical inactivity. And if you look at this picture, so this was done in 13,000 individuals where they were enrolled, and their fitness level was assessed. And then they were followed for the next several years, and they looked at the heart disease related events in these people, right? The green bars are women. It's same in both men and women, right? People who have low fitness level had the highest death event rates, and people who were thought to have good fitness, in them the events were much lower. And this is, again, they did not do any interventions. They looked at their fitness level, they assessed their fitness level, and then they just followed them. What happens? Why is inactivity a problem, right? So first of all, the human body is not designed to be inactive. The way the enzymes, the way the organs work, it needs a certain level of activeness. And so when people are inactive, what happens is the blood vessels can get stiffer. They get stiffer and stiffer. Then their body weight goes up, right? Then the cholesterol metabolism, the sugars, the blood pressures can get worse. Then and also it can affect their mental health. Now, with all this, they have higher tendency to acquire other poor habits such as smoking and alcohol as well. Obviously, when they exercise, it's like opposite effects, right? It makes the blood vessels, with regular exercise activities, the blood vessels will be more flexible. The heart can pump stronger and efficiently. It doesn't have to, for example, beat at 80 beats per minute if we had to walk from here to like around the block. Even if it beats 60 times per minute, if a person is fit and beats 60 times per minute in an efficient way, that's good enough. So let's work for heart, right? And it can effectively pump oxygen to different parts of the body. It helps, the exercise helps with having good mental health, right? And reduces the stress hormones. We can lose weight. It improves the quality of life. And these are only very few, very simple like points I put in, but the underlying mechanisms are definitely more complex. Now, so we will briefly touch base with each of these risk factors. I mean, we know that in general, all these risk factors increase, they're called risk factors because they increase the risk of heart disease. But we'll just learn few facts about each one of them. Now, so overweight and obesity, right? The prevalence has been going up. And so here I've just put in the numbers to bring it to your attention. So the normal weight BMI is 18 to below 25. So that's the normal range that we want to be at. Then anything above that, initially we consider it as overweight. Then there is a classification. Once it is above 40, we call it morbid obesity by then. And again, this is just to bring more awareness. So the graph here shows that, and then I also want to bring it when I want to explain this. When we say high BMI, body mass index, or obesity, right? This is not just only about the weight or the heart has to pump harder. Yes, all those happen. But another important point is, again, overweight and obesity, these are inflammatory states. Increased fat cells or increased fat content or the size of the cells, we call it adipose tissue. It revs up, it sets inflammatory processes. Okay, and in this picture we see that the increase in BMI increases the risk of hypertension. And same thing with diabetes. And the prevalence of diabetes has dramatically went up due to the increasing prevalence of the overweight and obesity in the past 20 years. And if you look at the events, right? So high body mass index is an independent factor, risk factor for this stroke related to ruptured blood vessel, stroke related to blockage in the artery or clot in the artery, and blockages in the arteries of the heart. This is to show that one of them is extrapolation. So just projecting the data and predicting what could happen if you're not acting on this and if you're not taking care of this, right? So many of the young adolescents, they're gonna, with the increasing prevalence of this obesity or overweight, the projection is that as if it keeps going up, the prevalence of heart disease is gonna go up very high in the future. So starting from the young age, addressing these conditions is important, meaning looking at the diet, their physical activity, their weight, and keeping them healthy helps them to continue to stay healthy when they grow older. So briefly about cardiometabolic syndrome, you probably heard about this term, right? So sometimes what happens is when if we just calculate the BMI based upon the formula I have displayed, it may look like, oh, they're maybe only mildly overweight. But in actual reality, their risk can be much higher compared to another person who is in the similar weight range. The reason is, it's not only about the overall weight, but where the abdominal circumference, meaning where the fat is getting deposited. We call it visceral fat. So a lot of fat deposition in the tummy around the organs. Again, it can set up the inflammation. So when people have that, their weight might not look too bad, but their abdominal circumference is larger than the optimal level. Or if they have any of the other risk factors, meaning the triglycerides, part of the cholesterol is just borderline high. Sometimes things may look like, oh, it's only just borderline, but everything together puts them at much higher risk. Their sugars, again, they may look like, oh, it's only borderline high, but all those are very, very important. Now, moving on to diabetes. Again, this is one of the major risk factors So diabetes, again, it's not about only the sugars, meaning like, oh, is the sugar 120, 150? What happens is it's a continuous process, right? These sugars are circulating in the system continuously, high sugars. And this condition also sets up certain inflammatory pathways. And together they are constantly damaging the blood vessels. The sugars they bind to different types of proteins, and they keep damaging the blood vessel walls. It's not only the large blood vessels, but also the small blood vessels within. For example, if you're talking about the heart, right, the heart pumping, a lot of times, for example, like sometimes people get an angiogram, and the arteries on the top of the artery may look fine and the heart may look fine, but they still have symptoms because the tiny arteries within the heart muscle, they're blocked, or they're not working well. So that is also a major problem. So diabetes, it's the number one cause of deaths in people with diabetes is heart disease. And they are at threefold higher risk compared to the general population who does not have diabetes. And once they have heart attack, they are even at higher risk when we compare to population who had heart attack, but they did not have diabetes. So it is that important to realize or understand about it. Now, and also what in clinical not the terminology, but when we see a person with diabetes, we actually consider them as what we call as coronary artery disease equivalent, meaning even though they were not diagnosed with blockage in the arteries supplying the heart, once they have diabetes, it is almost equal to that. It is that important to have this under control. Now, women in diabetes, what do we know? So basically, at this point, like the recent statistics showed that at least 26 or even slightly higher, like million people in the United States have diabetes, and almost half of them are women. Right. And women with diabetes are even at higher risk for coronary artery disease compared to men. Again, there is difference in the lives, across the lifespan. If we have like young adult boys and young adult girls, so the incidence of diabetes is little higher in youth, young girls, just because of the difference in the hormone changes at that time. But like by midlife, we see a little higher prevalence in men, and after that, it's kind of equal in both genders. So why this is important, right? Like, for example, a young girl at 25 have diabetes. They are exposed to this for such a long duration of time compared to someone who are diagnosed with diabetes when they are 65-year-old, right? So, and we have adequate data from different sets of research studies, and one of them is the Swedish Heart Registry, where like it showed that if a person has diabetes when they're younger than 40, they are definitely at much higher risk for future heart disease. Again, so now moving on to hypertension. Hypertension is high blood pressure, right? The blood vessels can get stiffer, and there are other mechanisms that come into life, the other hormones that are produced into the circulation that lead to high blood pressures. The numbers I'm displaying just for the sake of raising the awareness. So all this comes down to, like, what it tells us is timely health screens are important, right? Like seeing your doctor, for example, like if there were no risk factors in the past, but still like at least once a year, like after a certain age, and see how your blood pressures are, how your blood work is, and have them assess the risk factors, right? Like for example, if there is a family history of heart disease. Now, and both, so as the blood pressure goes up, the risk for heart-related events could be cardiovascular death, it could be heart attack, the stroke, they go up. And women in hypertension, the pre-menopausal phase, the instance, overall prevalence can be a little lower in women, but it catches up very steeply though. People used to think, oh, there will be at least 10 years lag between men and women before these risk factors start. But like what we have seen is women can have steeper increases in blood pressure, which can begin as early as the third decade, and it persists with aging. So the steeper increase in the blood pressures. So it's very, very important. After menopause, yes, one is when the hormone-related changes, and there's certain receptors that can get upregulated, so that can put women at a slightly higher risk for developing hypertension in their at that age. And I'm putting very, very brief points for each condition, not to overwhelm you with too much of information at the same time. But at the same time, I want you to understand at least what it is and why is it important. Now, the dyslipidemia term, it means basically deranged cholesterol levels. So what happens here is it's not just, okay, first even to talk about the terminology, right? Here I put it as LDL is the so-called bad cholesterol, HDL is the good cholesterol, and the triglycerides, that's also part of the cholesterol. Now, it's not only the cholesterol number, it's important, yes, the cholesterol number needs to be taken into consideration, but it's also sometimes the number of particles. It's again, the cholesterol, when we say, we just use a general term, but there are different particles in cholesterol. And it's the type of particles, number of particles, because sometimes actually we see lower cholesterol levels than even like the optimal range we expect, but they're still at high risk for heart disease because these particles are aggressive, or the too low cholesterol is an indicator of something else going on there, inflammation. So again, all these have to be put together based upon that individual person. And here I put LDL cholesterol. We want it to be below 130. But this is for like overall set of recommendations. But there are certain high risk groups. For example, if there's family history, or there is kidney issue, or there is already a blockage that was identified in the artery, or diabetes, we want to keep that the target is even more strict. The goal is to keep that bad cholesterol below 70. Now, moving on to the smoking, is another important risk factor. It used to be the first most preventable risk factor, like cause of death, until 2000. In 2010 statistics, this table, I put it like I put it because it was available in the form of table, but for 2010, there is no table available, but it moved to the second place. Now the poor dietary habits or suboptimal dietary habits have taken the first place. This is to show that when there is smoking, it increases, it is like diabetes, it is another major risk factor that can contribute to heart-related disease or vascular disease. So first few cigarettes, and for first, like initial smoking itself can steeply increase the risk of the disease. Yes, with the number of cigarettes, like it can continue to go up, but even with little bit of smoking, there is increase in cardiovascular risk. And that's why when people, they're working on quitting or reducing it, sometimes says it works by reducing it initially and then stopping it. But we always advise patients, the ultimate goal is to totally quit, totally stop smoking, because even few cigarettes per day still confers a very high risk of future heart disease. And same thing with the secondhand smoking. There is increased risk for heart disease. Now, so we are at 6:51. Okay, so the cornerstone, right? The lifestyle management and being aware of health screening. So when we say lifestyle management, what is it? Is we are addressing the physical inactivity, the diet, and the stress, right? So diet, right? I learned this along the way, and I always tell anyone around me or my patients, two most important things for a human being, very, like when we're talking in terms of the health here, right? What we eat and how much we exercise. Crucial, very important. So the diet that we consume is majority of it like plays the role of what we are, right? It's very, very important. So there are several sources online. If you can go to the websites I mentioned here, basically myplate.gov or American Heart Association, heart.org, American College of Cardiology. They have plenty of information, other reliable websites, the nutrition source. So this is how our meals need to be. So in our plate, half of it needs to be vegetables and fruits, and rest of the half, so 1/4, whole grains, very, very important. Then healthy protein. So here with the vegetables, we want to go for different colors, right? And we should not be considering potato as a vegetable, right? So it has a lot of negative effects on the sugars. So different colors and whole grains, very important, right? We try to stay away from the refined grains, refined diet as much as possible. And healthy protein, we can start with the nuts, different types of beans, pulses, poultry, fish. So all those can be utilized. Then healthy oils in moderation, right? Like olive oil, sunflower oil, but in cutting down and using it only in moderation, and drinking plenty of water, avoiding the sugary beverages, right? It's very, very important. Now, so we have, again, plenty of data show that to convince us that how a person's dietary habits can affect their health, right? So again, they looked at hundreds and thousands of people, different types of studies. When they increased their fruit and vegetable consumption, fiber consumption, eating diet low in fat, especially trying to avoid the trans fats, right? It reduces the blood pressures. Even if the blood pressures were a little on the higher side, with the dietary interventions, it comes down by certain points. Then they have another study where like they looked at how a lot of people, and increased fruit and vegetable has shown to reduce the risk. Same thing with the whole grains and fiber. The higher the consumption is, the better it is. Just to summarize this, right, like to give you the numbers, when people were highly adherent to a Mediterranean type of diet, the death from any cause, death from heart-related causes, death from cancers, they have significantly came down. So goals for diet interventions, key, right? It's not only for heart disease prevention, right? If we do the right things for one reason, it will help for multiple reasons. It helps with the digestion, with the gut health, joint health, bone health, and prevents malignancies or cancers, cognitive health, right, for the brain health. So adherence is the most important thing, right? Like if we do it one day, we don't do it for 7 days, it really doesn't work much. probably still there is a little bit of benefit, but it works with adherence. And I always tell my patients, like, because what happens is sometimes people try, they honestly try, but they might not see much changes in the weight loss. I always tell them not to get discouraged. There is always like a lot of plateau phase for everyone based upon their metabolism and based upon how much they're able to do. So first thing is not to gain any further weight, right? Then trying to stay fit and be very physically active at whatever weight they are at first. Then being adherent to the regimen and losing the weight, right? Now, physical activity, right? We don't want to, we want to be innovative, but not like this, right? So again, plenty of information on American Heart Association website. They'll give you different types of tips and a lot of motivation there. Always, again, like the question is how much is needed, or how much is the required level of physical activity. So again, looking at like a lot of data, looking at larger sets of people, what we came up with is we need at least 150 minutes of physical activity throughout the week. Preferably, we want to spread it throughout the week, right? Moderate intense activity. Sometimes people want to do higher intensity activities, that's also fine, but at least moderate, vigorous. Then adding muscle strengthening exercises at least 2 to 3 times a week. But if we can do like more than up to or more than 5 hours per week, that's even much better. It's not only for the cardiovascular health, again, for mental health, right? People feel better when they exercise. They feel more lighter. They have good night's sleep. Their cognition will be better, right? I'm a big proponent of yoga and meditation, because again, they are not just another form of exercise. So the human body, again, like our thoughts, how we, what we do, how we do, it's a complex, it's a result of complex set of chemical activities, right? A lot of them we might not even understand. So to keep those chemical reactions under balance, right? So mindfulness, like with meditation or yoga, because yoga, it may look like physical exercise. Yes, it is, but it does more, it has more benefits than that. So to balance that chemical reactions in the body, right? So it's very, very important. And then again, like few of the tips just to tame the stress, right? Try to maybe slow down, because sometimes we try to multitask and do too many things, because stress to the body is as bad as any other risk factor like diabetes or having a malignancy. So stress is something that everybody needs to learn not to get their body or brain there. Right? So connecting with with your friends, families, just to make it again lighter for you, getting a little more organized so that you find time to exercise and able to prepare healthy meals for yourself. So very important. And so keeping the willpower up, right? So sometimes it may look like, oh, 2 weeks you did it, but after that, oh, there is no motivation, because it goes into a cycle. The less a person is physically active, the less motivated they will be, and less well they feel, and it goes into a cycle. You want to break that cycle. You want to reverse that. So sometimes you won't be able to do it. You should not feel bad about it, but just take it fresh and do it, like without thinking about it like too much. Oh, I didn't do, like just go for it. Like if you're not able to do moderate intense activities for like a week or two, just do lighter activities, just even walking within the house, like doing laps in the house, like going up and down the stairs. And if you are working and you have sitting or desk kind of jobs, make sure like you have a stand-up desk that if you can utilize. And every 1 hour or 2 hours, keep a reminder on your phone or like in some other way So you just go for like a walk in between, even to grab a cup of water, just take fresh breath of air. So there are so many things that can be done, and there is help, like the way I was saying, like on heart.org or like American Heart Association, plenty of tips. And I believe you should be you can also enroll into it, and maybe if you have questions, you can send questions to them. Um, so so these, in summary, right, to keep life simple, 7, to eat better, get active, then keep the risk factors under control, or even prevent from developing these risk factors. Now, again, I'm just like 2 or 3 more slides, I'm done here. So it's important to have this awareness at all age groups, right? To consume healthy diet. And again, the habits, the earlier they start, and the younger we are when we start this, the better it is. But at any age, at any time, we can start doing this. And so in the 20s, so initially like regular wellness exam, just staying physically active. In the 30s, like by then, like to get into that risk stratification, making sure like if there is a family history, what else can need to be done. And by in the 40s, because the metabolism starts changing, so getting again more aggressive, or continuing to maintain that physical activity. And continuing those habits with a healthy diet, then getting then the snoring, right? So we talked about sleep apnea. So do not brush off snoring. It is an important risk factor for heart-related problems and many other problems. So please get evaluated for it. Then if needed, further risk stratification. In addition to the regular labs that we do, sometimes based upon this risk profile, we can utilize coronary calcium scoring to see if there is, like, do we see like initial signs of calcium deposition in the arteries supplying the heart. It's not needed for everyone. It's not a routine screening one, but in some individuals, we can utilize it. And then again, regular visits and treating the conditions if there is hypertension, diabetes, high cholesterol. Then same thing in the 60s and above. So thank you for your attention and your time. Any questions? I will take them.
Yeah, I have a question, Dr. Bumradi.
Yeah, please go ahead.
Yeah, so I mean, great presentation. Thank you for taking the time to share with us. So one of the problems that I commonly face is like many of these patients that come here, and the problem is we always encourage them to eat healthy and exercise, but half the time they need a little bit more support in terms of working on their diet on a more personal level, and we sort of can't provide that when you have patients booked every half hour. So do you feel like pushing for more cost effective, or like in terms of nutritionists, or the other programs and resources we have here is beneficial, or do you first give them a little bit of encouragement and see how well they do on their own before pushing for services that we offer?
Yeah, no, that's a great question, Sid. So yeah, that's the challenge, right? The current practice. You want to give all that information to them, but there's also time restriction, and patients may not be able to absorb all the information at once as well, right? If you give them like too much of information during the same visit. I'm again a big proponent of utilizing a nutritionist or a dietitian, because they can actually tailor it to the individual needs. But I guess that comes down to the realities stuff such as the insurance. I mean, I always feel like, why doesn't the insurance, I hope they are not, or they should be actually here on this conversation, why the insurance companies doesn't catch up to this. Because a lot of times, unless there's certain diagnoses such as diabetes or known history of coronary artery disease, or with especially like requiring intervention, I don't think a lot of insurances approve for a formal nutrition or diet consult. But the hospitals, we are trying to be innovative to see how we can incorporate, right? And also even like outside the hospital, for example, like even the Mandelson, right? Like the program, the JCC, where they have the programs, people can nicely get enrolled there, where they can have one-on-one consultation, and then see what works better for them. And in the hospital, like for example, we have the cardiac rehab programs here. Many of them are not insurance approved, but it can be utilized as a program, meaning like at very low cost, at very, I would say, very reasonable cost. That people can enroll, where they get consultation with a nutritionist, exercise physiologist. I think like the way you said, like, yes, it has to, like, we need to take another step in addition to the formal visit they have with us. They need to, they will highly benefit from taking that extra step. That will actually help them to in long term, meaning because it's not like one visit. For example, they can take 5 class sessions, like a plan, or like 10, something like that. So that makes a big difference, and they can take material to home that they can read, or like get the website information and browse it and make points for themselves. But I'm hoping that more and more, I mean, like the insurance, if they change, that will also make a big difference, and more people will benefit from it.
Okay. Yeah. So that's good. And then one sub question to that is, when you're educating in your experience, like, do you feel if you mention stats and facts about, women and heart disease in women, does that bring a more interest and improve and a patient interest in trying to improve their health? Because everybody hears to eat healthy and stay active, but like maybe sometimes they need a different perspective in terms of telling them how women are a little bit of a greater risk, and sometimes providing statistics gives them a different perspective into taking their health into their hands and more action on that.
Yeah, absolutely. Yeah. So I'm thinking like, yeah, we can, I mean, every healthcare provider, they can be innovative with this, right? Like if they can have like some pictures, like in the form of cards that they can sometimes share with the patients and give them the facts. Yes, it will make a big difference if we explain it to them in that way. Yeah.
Okay, thank you.
Yeah, sure.
Does anybody else have questions?
Rita, it's Lisa. It was a wonderful presentation. I really thank you very much for it. I've been getting text messages from some of our colleagues about things that we need to do in our office, which is wonderful. So I thank you very much for putting us on that path. And yeah, you're right. Nutrition is a huge ordeal, and we cannot get it paid for. It's several $100s, and most people don't want to spend the $300 or $400 that it costs for a nutritionist. But it's obviously highly sought after and highly recommended, but we need to sort of work on that from our aspect of it. But I do appreciate it, and I do appreciate the numbers in terms of the increased risk factors for heart disease in terms of the sedentary lifestyle, as well as depression. And we see a lot of patients now, since we have now the formal Women's Health Initiative with the broken heart syndrome, and how depression and anxiety plays into it, especially with the young women too, which I was very surprised to see. So I thank you for that information also. It's been really wonderful tonight. So thank you for your time.
Thank you, Lisa.
I just wanted to add a couple of things too, that we do have meditation that's free to the community, not just JCC members. We do it every Wednesday at 11:30, and it's a Zoom link. So you don't even have to come in here. So if anyone is interested, I know everyone has my email because I emailed you the link here. Just email me and I will send that link to you. It's again, every Wednesday at 11:30. It's about 15 minutes. And then we also do have a nutrition consultations here as well that are not $300.
I think I'm going to give it out to my residents for the meditation.
Mhm. And I open it up to anybody who wants to do any type of consultation on exercise, that I'm happy to do a free consultation by Zoom, on the phone, or even coming in and meeting with me. I think it's so important. And, you know, this is just such a fantastic place for every different age group. And I'm happy to open that up to everyone as well.
Oh, that's excellent, Sharon. Thank you so much for sharing with us. Awesome. Yeah.
Well, thank you so much, Dr. Bumradi. I loved it. Great presentation. I hope everyone got a lot out of this. I know we got a couple thank yous from people who had to sign off already, but thank you for your time.
Thank you. Thank you all. Yeah. Have a nice evening.
Thank you.